I'm Dr. Rohini Paul. So this is about the nursing skill tip. So today I want to talk to you about a very important procedure, that is the chest lead placement in the 12 lead ECG. So always the nurses have one question, that is, this particular ECG is called 12 lead ECG. But we are only fixing 10 leads we are fixing, that is 6 of chest leads and 4 of the limb leads. So total it comes to 10. Then why is it called 12 leads? So the answer is, we are fixing 10 electrodes, but 12 perspective of heart activity through different angles of the heart. You all know 3 dimension, our heart is pumping like that. It is an organ. So what happens, 2 electrical plane, which is coming in the horizontal and in the vertical, which is representing the other 2 areas. That is why, though we fix only 10 electrodes, we are able to get the activity of the heart as 12 lead ECG. So now, what is the method of fixing this 12? Where do you fix? As you all should know, 4th intercostal space, our heart is situated. So remember this 4. Please remember 4. That means, why I am asking you to remember this 4? 4th intercostal space. See, this is the clavicle bone. From clavicle, next starts 1, 2, 3, 4 ribs. What is intercostal? The space between 2 ribs are called intercostal space. So, 4, remember this, 4 chamber heart has got. Somewhere you connect with something, so you will not forget. So, everybody knows heart has got 4 chamber, 4th intercostal space. Where will I place the first lead? Always you give importance for your right hand. So, fix the first lead in the 4th intercostal space in the right side of the sternum. Exactly on the left side of the sternum, the second lead you place, 4th intercostal space. Don't fix the 3rd immediately. You go for the 4th one. So where do you place the 4th? You have the clavicle bone on the left side. Exactly middle clavicle, you draw a line on the 5th intercostal space. So that is what your 4th lead. The 3rd lead will come exactly, draw a line between the 4th and the 2nd. You get the 3rd lead placement space. Again, where do you fix your 5th lead? That is your anterior axillary. See, your axilla is this axillary area. This is the mid axilla. This is the anterior. This is the posterior. So you have your anterior axilla on the 5th intercostal space. You fix the 5th one. Then the mid axilla on the 5th intercostal space. You fix the 6th one. So here, please remember 2 areas on the 4th intercostal. That is your 1st and 2nd. The 4th, 5th and 6th will be in your 5th intercostal, and the 3rd will come exactly between the 2nd and 4th. So this is the way it should be fixed. The only reason I am doing this, if you don't fix the lead in a proper way, your ECG will come out wrong. And if your ECG is going to be wrong, and the patient diagnosis will be wrong. So everything lies on the nurse's hands. So I want you to learn this and do the method as it is been expected. Thank you.